I am Charmaine Rochester, and I'm the Chief Financial Officer at Chester County Hospital. I'm originally from Jamaica, but I've been here in the States for over 30 years. So we originally came to the States when my mom was recruited as a nurse to work at a hospital in Texas. I went to college in Washington, D.C. I attended Howard University. Then I got married to an active duty sailor. Even though my mom was a nurse, I wanted nothing to do with healthcare. So I figured business was a lot more safe for me, and I could manage spreadsheets. There's no blood involved when you're looking at spreadsheets. And so for me to end up in healthcare is really surprising. My leadership intention is to inspire and encourage those around me to be their best selves. My leadership philosophy for the teams that I lead is that I want to see them strive for excellence, and at the same time I want them to be caring and compassionate, including caring for themselves.
So when I think about the things that my mom has done to support other women, specifically women of color, whether it's within healthcare or just within the community, it really means a lot. She showed me, without ever saying anything, that representation is everything, because young women don't always have that role model so easily accessible as I did, growing up in a household with this amazing hero. So she showed me that the #1 way to give back is to give your time, to listen, to encourage, to uplift and create these spaces and these environments for women who maybe didn't necessarily have that tangible role model growing up.
Charmaine is a financial leader who is focused on the success of an organization, but takes in all of the aspects of that organization, and most importantly, the mission of our organization, the most vulnerable in our community who need access to care. She is able to facilitate sometimes very challenging organizational discussions, but she is able to allow everyone to participate and make sure they have had their say. But at the end of that conversation, she's able to move forward the group to a consensus so that we are able to make the best decisions for our organization.
From her heart, she started a group called Legacy Builders, and she invited a group of 12 to 15 black women to have an off-site half day where they hear inspiring things, they share their stories with one another, and they walk away excited about the possibility of growing and seeing a black female in a leadership position who's also not just taking care of herself but looking back and trying to bring others along is just a special talent that Charmaine brings.
My whole life, she's been a role model and what I strive to be in everything that I do. She exemplifies such good characteristics, and I know she's an inspiration to everyone around her, as well as those individuals that she takes the time to mentor and help become the people they want to be.
Charmaine is not just technically excellent, she is, but that's not the end of it. She also loves people, and it's very clear. She's very empathetic and compassionate. She's very focused on other people's development, and sometimes the chief financial officer is in a role where they're not as attentive naturally to the people side of the business. Charmaine is a tremendous partner to me in leading with compassion, love, and respect.
She always remembers that the numbers mean real people to us, patient lives that are desperately in need of health care, and Charmaine always has that top of mind.
What I'd like to say to girls who are thinking about the future, you can be whatever you envision for yourself. And I think it's important that we provide role models and opportunities for them to see what they can become. They need to see other women excelling in different fields. But at the end of the day, the most important lesson that they can carry with them is to remember that no matter what voices outside are saying about them or to them, I want them to remember that they are lovable, that they're valuable, that they're worthy, and that they're enough.